Hey there everyone. In the previous video we had studied the deep peroneal nerve, origin, plexus, course, beginning, termination, branches, relations and the diagram, etc. Before that we had covered the anterior tibial artery. Before that superficial fascia, deep fascia and the nerves, the veins, etc. So in this video this is going to be the last video of this chapter. So clinical anatomy will cover it very soon because it is a very short topic. Now the first one is the, let me change the color to, okay, oh, okay, entrapment neuropathy. Okay, entrapment, what does entrap literally mean? Trapping of the nerve. Okay, trapping of the nerve. The trapping of the sphincter nerve in the adductor canal is called as the entrapment neuropathy. Which entrapment? Sphincter nerve entrapment neuropathy causes pain in its area of supply. Okay, sphincter nerve supplies to the medial side mostly of the leg, so severe pain on the medial side will be felt. Now, Fresher syndrome. What is Fresher syndrome? It is also called as the anterior tibial compartment syndrome. Okay, the Fresher syndrome is also called as the anterior tibial compartment syndrome. How do you remember this? Just remember that freshers, whenever you join college or universities, you'll be given freshers party. So anterior, okay. Just remember the the students take entry from the anterior gate and not the posterior gate. So it is the anterior syndrome. So the anterior tibial compartment syndrome, I know it doesn't make sense, but still just remember it. The muscles of the anterior compartment of the leg, it supplies the muscles of the anterior compartment of the leg. Okay, but pain is occurred. Okay, pain is occurring due to sudden exercise. Okay, and that area where there is pain, it is very tender to touch and it causes more pain if you're touching it. Okay, so we must have seen this in childhood, right? We are running or something and we ran after so long, we're playing after so long, so we usually feel pain in the quads, in the quad muscles and in the calf muscles. So it is due to you just understand it like that. It is a fresher syndrome. The fresher students come to the college to the anterior tibial compartment, to the from the take entry from the anterior gate. So the Fresher syndrome, it is through the anterior tibial compartment and pain is occurring there and it is very tender to touch. It is due to the exercise. Okay, due to the exercise, because the freshers, they have danced a lot, that they are having muscle pain. Just remember it that way. Now talking about the foot drop, it is an important thing. In upper limb we had the wrist drop due to the radial nerve injury. Here we have foot drop. Okay, foot drop. Now muscles of the anterior compartment of leg, that is the tibialis anterior, extensor hallucis longus, extensor digitorum longus and the peroneus tertius are supplied by the deep peroneal nerve, right? So injury to this nerve can cause problems in this muscles, pain and loss of the dorsiflexion. Person cannot dorsiflex the foot due to foot drop. Okay, due to foot drop he cannot dorsiflex, and this foot drop is due to injury or disease to the common peroneal nerve or directly to the deep peroneal nerve due to trauma, leprosy, peripheral neuritis. What is peripheral neuritis? It means that damage to the nerve that is outside the central nervous system. The central nervous system contains the brain and the spinal cord. The nerve that is outside of this region is called the peripheral, because periphery neuritis, it is due to the damage to the nerve. It also can cause injury to the common peroneal nerve or directly to the deep peroneal nerve. Causes sensory loss, the first interdigital cleft, because this is supplied by the deep peroneal nerve. Okay, the deep peroneal nerve. Okay, and its branches and stuff, whatever branches are there of this can also be affected. So this is about the foot drop, an important topic, important clinical anatomy. So we're done with the clinical anatomy and also done with the chapter that is the front of leg and almost a little bit of dorsum of foot. Okay, dorsum of foot. We are only left with the muscles. We'll do that soon and complete the medial side of the leg and the lateral side of the leg, and we are completely done with this, and then we'll start with the foot. Okay, then we'll do the arches of foot, and then the plantar portion, and then we are done with the chapter, done with the whole lower limb. And then I'll create a video of complete lower limb anatomy only in one video, like a fast revision, so will be beneficial for those people who will regularly watch my videos. Thank you so much. Do subscribe.